Now, this is one of the most important topic in diabetes, and that is the how do these ultra fast acting or rapidly acting insulins they act versus the regular acting insulin. Now, regular acting insulin means injection actrapid, which is extensively used in all the setup. Most of the patients, those who are admitted in the hospitals, they are put on this regular acting insulin, whereas this rapidly and ultra fast acting insulin is significantly less commonly used. The main thing behind both is the price. Now, this regular acting insulin, around 300 units, we get around at 350 rupees. So, one unit is equal to 1 rupee. And compared to this ultra fast acting insulin or rapidly acting insulins, the 300 units, we it costs around 700 to 1000 rupees. So one unit is equal to 2 rupees, 2 to 3 rupees. And in India, where there is a huge population of the patients, which can definitely have some financial crisis, and not only the financial crisis, because most of the time, most of the diabetic patients are usually put on 10 units, 20 units, 30 units, 40 units, 50 units per day. So just imagine if a patient is put on 50 units per day, like divided into 12 units in the morning, 12 units in the evening, and 10 to 20 units at night. So if patient is getting 50 units per day, that this 300 unit cartridge is going to get ended within 6 days. If someone is getting 30 units per day, within 10 days, this cartridge is going to end. That is the reason why affording this ultra fast acting insulin can definitely be very costly, not only to all the patients, but few other patients. Now, what is the main difference? We know that when we eat, we always have this blood sugar level, which is like this. This is the basal, our blood sugar levels, and this is the insulin levels that our body secretes. But in diabetic patients, the problem is this insulin levels are either low or they are resistant. These patients have insulin resistance, so they need higher insulin levels. So whenever patients eat, the sugars rise, and over a period of time these sugar falls. So most of the time this period is around 2 to 3 hours. So within 2 to 3 hours, whatever the patient has taken, the sugar levels come to the normal level. So this is suppose breakfast. Again, after in the afternoon, as soon as the patient eat, the sugar rise, and then again within 2 to 3 hours of taking the food, the sugar level should normally come to the baseline. And again at dinner, when they take patients dinner, within 2 to 3 hours of taking this food, the sugars should come back to the normal range. Normal means whenever we are talking about fasting, the sugar should be, the BSL should be around 100, less than 100, or 80 to 100. And whenever we are talking about postprandial blood sugar levels, it should be in between 110 to 140. So what happened in these patients, this sugars, which should come within 2 to 3 hours to the normal limit, these ultra fast acting insulins actually work like same. So these ultra fast acting insulins, they basically get very rapidly absorbed from subcutaneous surface as soon as these are injected, and they start acting within 5 to 10 minutes, and their peak of action is at around 1 hour, and their activity lasts for around 2 to 4 hours. So whatever they have taken, these ultra fast acting insulins can actually reduce this blood sugar level within 2 to 3 hours. So these act like a bolus insulin that our body releases, whereas these short acting insulins, they are kind of slower to act. So what actually happens is these regular insulin, like injection actrapid, it starts its action within around 30 minutes. It peaks at around 2 to 3 hours, and the activity of this regular insulin lasts for around 6 to 8 hours. That is the reason why the risk of postprandial hypoglycemia is higher with this short acting insulins. So this is the reason why these fast acting insulin, as they start acting within 5 to 10 minutes, these are recommended to take around 5 minutes before the food, whereas the short acting insulins, they should be taken around 10 to 15 minutes prior to taking the food. So the main difference between the two insulins is price. These are compared to much cheaper, the short acting insulin injection Actrapid, whereas this fast acting or ultra fast acting insulin, they are pretty costly. But when it comes to their activity simply disappears within 2 to 3 hours. Whereas in patients who are taking this short-acting insulin, the insulin continue to act around 6 to 8 hours after also. So you can imagine if a patient has taken food, their BSL has already come to the normal at upwards suppose after 3 hours. But still this rapid insulin continue to act, and it can cause the hypoglycemia. Uh, for that, we need to really understand how the patient's BSL is remaining. If we can understand patient's BSL graph very well, we can definitely treat the patient's sugars very well. If suppose for a patient who has blood fasting sugar of around 200, and at evening at night if it is still remaining 380 or 300, then definitely this short acting insulin can also give us a good cover by acting for a prolonged period or for acting for a long period. So choosing this short acting insulins or ultra fast acting insulin, they act almost in a similar only. The main thing is price that should be kept in mind, and postprandial hypoglycemia risk, and whether the patient can take these injections at a very regular timing or not. These all things has to be considered. And thanks for watching, and I'll be coming again with some other video. Thank you.